The Uganda Medical Association has warned that health workers handling the COVID-19 will soon abdicate their responsibility due to continuous outstanding challenges, including non-payment of their allowances.
Although the COVID treatment units do have PPE and are now receiving near sufficient personal protective equipment, this was inadequate, especially in the other areas of the hospital, like in the emergency areas, in the different clinics, outpatient clinics. And for example, again, in Kabale regional referral hospitals, health workers outside of the COVID-19 isolation centers could only access 2 disposable masks. Ministry of Health and the Ministry of Public Service should create a fund or a mechanism to put in compensation for these health workers who get infected in the line of duty.
Dr. Mukuzi Muhereza, the Secretary General of the association, says they randomly sampled Hoima and Fort Portal regional referral hospitals where they registered non-payment complaints.
I was in Fort Portal, and the meeting we had, out of the 50 people who were employed, only 4 were paid. I went to Hoima and nobody was paid among the team that was there. We went to Hoima Regional Referral Hospital. We went to the administration. And the administration was, dilly-dallying. We have created the numbers. I'm told there is some system which you have to create.
During the same meeting, medical interns represented by Dr. Herbert Luswata urged the Ministry of Health to urgently resolve issues regarding their period of service, which expires in August.
We shall not have continuity. So the intern doctors or nurses who are supposed to come and replacing us after graduating from universities will not have come by 1st October.
Unless the 5th year medical, dental students or the final year, 4th year pharmacy and graduate nursing students complete their training from university and are released in October to take up this post, Uganda is going to suffer an enormous human resource crisis.
However, Minister for Health, Dr. Jane Ruth Acheng, says interns will be free to choose whether to remain serving in the health facilities where they are placed or leave.
If we are to retain anybody, they will have to have a short-term contract with us until they are validated and taken on by the Health Service Commission. So we do not extend internship because the internship period is fixed.
Dr. Acheng says she will follow up with the Permanent Secretary on the issue of payment for health workers.
The regional referral hospitals like Hoima have money on their accounts, so they make their own payments. It is not from the Permanent Secretary, Ministry of Health. So I will alert the PS that there is a challenge in Hoima, so she can follow up and understand why some health workers have not been paid.
Walter Mwesije, NTV.